February is Heart Health Month, a time to raise awareness about heart disease. It is the leading cause of death for women in the U.S. And today we're talking about the connection between menopause and the risk for cardiovascular disease. Joining me now is Dr. Monica Christmas, a menopause expert and gynecologist with UC Chicago Medicine. Thanks so much for being with me this morning, Doctor.
Hi, thank you for having me.
All right, we know, many of us, that all kinds of things change during menopause, but how are menopause and an increased risk for cardiovascular disease connected? It's honestly something I didn't learn about until recently.
Yeah, there's still a lot of research that needs to happen. But as you know, there are estrogen receptors all over our bodies. And the reason that menopause happens is that our ovaries stop making those reproductive hormones. And many areas of the body recognize it, including the heart. The vessels in the heart become stiffer, the muscle itself can become stiffer as well. And that can lead to some strain on our heart's ability to do the things that it does efficiently, which could certainly lead to heart disease or cardiovascular disease, as you've shared.
Yeah, okay, now I know research shows that women who reach menopause early, which is before age 45, are more at risk. So why is that?
Well, it's that much longer that you don't have those reproductive hormones. So somebody that goes through menopause at, say, age 35, the median age of menopause is age 51 and a half, 52. That's where most people reach the definition. And that happens because, or we define it as not having a period for a full year.
What exactly contributes to reaching menopause at an earlier age? I mean, is it, women are always worried about that or wondering, how does it happen?
Lots of different reasons. Sometimes we don't know. It can just be iatrogenic, meaning we don't actually have the cause for it. Certainly things like people that have really severe endometriosis and end up needing to undergo a surgical remedy for that and having their ovaries removed. Anybody that has to have radiation or chemotherapy may have some insult or injury to the ovaries where they stop functioning as efficiently as they should because of the treatment that they're receiving. But oftentimes there can be some other genetic things that happen, but many times we don't actually know why some people go through early menopause. So as you said, early menopause is earlier than age 45. Which happens, depending on what you read, about 3 to 5% of or affects about 3 to 5% of the population. And premature menopause happens before the age of 40, and that's about 1 to 3% of the population. And as I said, that's that much longer that person's doesn't have estrogen that not only helps our heart be healthy, but it also impacts our bones, how our brains function as well.
All kinds of things. Here's the key question. What can women do to reduce their risk of cardiovascular disease, especially as the years go by?
Yeah. It's all the things that we preach to people all the time. It's having a regular exercise routine. The American Heart Association recommends at least 150 minutes of vigorous exercise per week, and you can break that up any way that you want. I like to think of it as I could do anything for 30 minutes every day. But it's really important that people recognize that even a little bit is better than nothing. So if all you got is 10 minutes per day, do the 10 minutes. Adhering to a healthy diet, such as like a Mediterranean diet, has been shown in numerous studies to not only help improve cardiovascular risk, but people that adhere to a Mediterranean style diet have less diabetes, they have less cancer, they actually have less bone loss and less cognitive decline as well. Maintaining a healthy blood pressure, a healthy glucose control or sugar control in the body. All of those things are really healthy for us, but also just having good sleep quality as well, making sure that you're getting enough sleep. Not smoking is a huge one.
Yeah, right.
And really modifying your alcohol intake. There's not a lot that's really good about alcohol, but especially as we get older, women, we don't have as much of the enzyme that metabolizes alcohol. And so even drinking small amounts, we have higher concentrations in our bodies. And you will hear I get lots of patients that will say, I actually can't drink anymore
Right,
after
because it's
Christmas.
too
I
hard.
feel horrible,
Yep.
hungover.
Yep.
Is there something wrong?
All right. Well, Dr. Monica Christmas, all of this is really, really important information for women to know, and we thank you so much for sharing all of it with us this morning.